A 72-year-old lady with severe scarring of the lungs, secondary to sarcoidosis, was having progressive shortness of breath despite taking 11 medications. She came to us for help, and here's what we did next. So Camille, tell us about this 72-year-old lady with sarcoidosis.
So she came to our clinic with really severe symptoms, feeling out of breath, at rest, and with mild activities because this sarcoidosis was causing a lot of scarring and inflammation in the lungs. It also was affecting her eyes, and she wanted to have her heart checked as well, not just because that condition can affect the heart, but because she also had high blood pressure, sleep apnea, and really high cholesterol.
So here's a lady with a pretty well-defined diagnosis. Sarcoidosis, as many of you know, is a chronic inflammatory disease. It frequently affects the lungs, but it can affect other parts of the body. And so this patient had lots of symptoms related to the lung with significant sarcoidosis of the lung, but she was astute enough to know that she also was at risk for heart disease. So having one chronic illness doesn't prevent you from having another. So not only did we perform an evaluation for her heart, but we also evaluated her entire physiological system and made an assessment to come up with a treatment plan. So pretty astute patient, and so I look forward to seeing what we find. So Camille, what were the pertinent findings on assessment of this patient?
So on exam, her blood pressure was very elevated, she had leg swelling, and she just looked worn out and tired. Then on her testing, we did find extremely high levels of inflammation in the body, indicating systemic inflammation, but also a lot of abnormal cardiovascular markers. So her bad cholesterol, called LDL, was extremely high at 220. She had high lipoprotein a, another molecule we know increases risk of heart attack and stroke. And when we looked at her findings, we found she was at almost a 25% risk of heart attack or stroke in the next 10 years. And then her CT scan showed some arteries were 20% blocked.
Wow. You know, it's amazing. You stated a phrase, systemic inflammation. Many of you who've seen some of our recording before understand that inflammation is like a biochemical fire. If you've ever fallen off a bicycle and scarred yourself, you have swelling, redness, bruising, that's inflammation, but that's inflammation in a local area. The body's immune system is triggered, and immune cells, white blood cells, go to that area for tissue repair, tissue breakdown, and the like. Just imagine that local area of swelling, bruising being all over the body. And the manifestation of that is that you may have multiple organs affected. So somebody with systemic inflammation may come in just feeling bad and looking bad, as this patient did. She felt tired and worn out. And so our approach to treating her was to address that systemic inflammation. So what approach did we take with this patient?
So we met with the Integrative Care Coordinator who developed a food plan specific for this patient, consisting of food levels 0 to 4B, so raw plant-based foods, and also some targeted micronutrients based on her conditions and her levels of inflammation. So these included liposomal curcumin, which comes from turmeric, the root vegetable. We also had her on some liposomal vitamin C and something called poly-MVA, which is a concoction of different micronutrients that are really good for systemic inflammation.
You know, that's excellent. I like the way you describe that treatment plan, because oftentimes individuals who have chronic illnesses, they'll go and look up certain supplements or nutrients that are good for this ailment or that ailment. But what you need to do is have a comprehensive game plan and a comprehensive team. And so we put together a team, and we have a team of individuals which include integrative care coordinators who work with us to help these patients out. Because this is a patient who's going to be on this plan for an extended period of time. And oftentimes you have to make adjustments in the nutrition plan, adjustments in the micronutrients. And so we have close follow-up as well as clinical monitoring, as well as following the patient's compliance and the like. So all of these things come together to improve this patient's overall well-being and improve her chances for long-term success. So how did she do?
She did awesome. So the main thing I noticed when I saw her again was her energy and her expression was so much more joyful. She stated that she wasn't having any problems breathing at rest or with her activities. She had less swelling on exam and her blood pressure was controlled. So we did reduce some medications during that time. And then we also reassessed some lab tests and that showed significant improvement. So her bad cholesterol called LDL went down by 24%. And then molecules that bind the cholesterol to the arteries went down by 18%. And then the blood tests that look at inflammation and increased risk of death from heart attack or stroke or any cardiovascular cause, those went down by 20 to 90%.
Wow, wow. Many individuals will look at these findings and say, well, she lost weight, the 20-pound weight loss, and as a result of that, these other things got better. But based on our scientific evidence, we know that the biochemical changes are first. In fact, they're first and foremost. And I would argue, based on our scientific evidence, that the weight loss was reduced due to the reduction in inflammation. And so the improvement in her overall well-being started with reducing the overall inflammation, the systemic inflammation that we talked about. So by addressing this patient with an optimal nutritional regimen, targeted micronutrients, we put out the biochemical fire that affected her entire body. As a result of that, the swelling and excess tissue edema throughout the body was reduced. The other thing I want to mention that you mentioned, not only was she better physiologically, but her mood was improved. So psychologically, she improved as well. So an excellent case from an individual who had severe problems at a fairly advanced age, but turned it around pretty quickly. Now there's more work to do, but she's on a great path toward recovery. So I hope you got a lot out of this. And as usual, if you have any comments or questions, place them in the comment section, and we hope to be able to answer them soon. Until next time, we'll take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.